Let's start with alteration in fat and protein metabolism. We need to think about digestion when we look at fat and protein metabolism. Remember, digestion is a breakdown of foods into parts which can be absorbed easily and used by the body. Remember, the pancreas produces pancreatic enzymes, trypsin, which breaks down protein, lipase, which breaks down fat, and amylase, which breaks down carbohydrate. These are all essential for digestion of our meal. So that's the pancreas. And then there's also the bile that's made and released from the liver and stored in the gallbladder. Bile is also critical for digestion and absorption of fats and fat-soluble vitamins, your A, D, E, K vitamins, especially in the small intestine. With hepatobiliary disease, there's decreased bile, which leads to malabsorption of fat. For this client, we will need to place them on low-fat diets, high-protein diets, inclusive of vitamins. With cystic fibrosis, remember, cystic fibrosis is that genetic disorder that affects mostly the lungs, but it also affects the pancreas, the liver, the kidneys, and intestines. With cystic fibrosis, there's absence of pancreatic enzyme, and this leads to malabsorption of fat and fat-soluble vitamins, your A, D, E, K. You will see weight loss in this client, and that infection and lung disease in this client leads to increased need for calories and proteins. These clients will need to be placed on pancreatic enzyme replacements, like your cotazine pancreas. They will need to take these replacement enzymes before or with meals. We would also need to place them on high protein diets and high calorie diets in the advanced stages. With alterations in protein metabolisms, phenylketonuria, also called PKU, is one of those conditions. This is a rare inherited disorder that causes an amino acid called phenylalanine to build up in the body. PKU is caused by a defect in the gene that helps create the enzyme that is needed to break down this phenylalanine. So phenylalanine builds up in the blood, leading to intellectual delay. It could also lead to mental retardation, convulsions, behavior problems, skin rash, and that characteristics musty body odor. Both formula and infant breastfed babies should be tested a minimum of 24 hours after beginning milk. As part of our nursing considerations, we want to give these infants a specially prepared milk substitute called Phenylketonuria. If they have this condition, we will need to give them this specially prepared milk substitutes. We will need to place these children on low protein diets, no meat, no dairy products, no dry bean, no nuts, no eggs. Another condition would be celiac disease or SPRUE. SPRUE is actually an inborn error of protein metabolism. So it's an inborn error of protein metabolism. So you have an immune reaction when this client eats gluten. Gluten is that protein that's found in wheat, in barley, and in rye. When you assess these clients, what are you going to see? This intestinal malabsorption is going to lead to malnutrition in these clients. They will have diarrhea. They will also have this failure to thrive. So again, you can see how the diseased intestine looks like as a result of celiac disease. As part of our nursing consideration, we'll need to give them gluten-free diet. A mnemonic you can use to remember this would be no bro, no bro. Where B is barley, so you don't want them to have any gluten in their diet, so they're going to avoid barley, no rye, so that will be your rye. You can find it in bread. No oats, and no wheat. Another condition you would find this protein metabolism issues would be gout, which is an inborn error of purine metabolism. Here, breakdown of purines in protein metabolism produces uric acid, and this uric acid, high levels of them, leads to progressive joint deterioration. What's our nursing consideration for this client? We want to place them on low purine diet, no fish, no organ meat. So you need to know foods that are high or that can trigger a gout episode. Red meat, sugary drinks, seafood, alcohol, poultry. The client needs to stay away from all of this.